Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we'll be speaking with Dr. David Rosmarin. He's joining us here as the Director of the Spirituality and Mental Health Program at McLean Hospital. He's also Associate Professor of Psychology in the Department of Psychiatry at Harvard Medical School and founder of Center for Anxiety. He's joining us here on Health Professional Radio to talk about his brand new book titled Thriving with Anxiety. Welcome to Health Professional Radio, Dr. Rosmarin. Thank you so much for joining us this morning.
Thanks for having me on your show. Pleasure to be here.
Well, you have quite a bit on your plate. Tell us a bit about yourself, and let's get into what anxiety is and is not.
Sure thing. So I split my time between McLean Hospital, where I'm a program director, as you mentioned, and Center for Anxiety, which is a outpatient clinic, or actually a series of offices in Massachusetts and the New York area, which services about 1,000 patients, outpatients a year, doing mental health. So between those two, you're right, it is a lot on my plate. And then now with the new book, the purpose of this project, the Thriving with Anxiety book with HarperCollins, is to raise awareness in the general public about evidence-based approaches to anxiety and to highlight that sometimes anxiety is actually a positive thing.
Part of the title of your book is to make your anxiety work for you. What is anxiety?
Sure. Anxiety is the same as fear. So it shares the same brain circuitry, the same physiology as fear, and we all know that as the fight or flight system. But there's one key difference. Anxiety happens when we perceive a threat, which might not be real, and fear occurs when there is a definite, clear, and present danger that we're in front of. So anxiety is in some ways a misfire of this healthy fear response. Fear keeps you healthy, right? Fear protects you from danger. It's a fight or flight response. The adrenaline goes through our systems. It's a very healthy thing. Anxiety is just a misfire of that system.
Does anxiety have a code, an ICD code?
Sure. Well, anxiety disorders do. And here's the interesting piece, is that, we have this essentially arbitrary cutoff between too much anxiety, too little anxiety. And in some regards, it makes sense. People are having what we call significant distress or impairment. They might have an anxiety disorder, which would indeed have certain diagnostic codes and then certain procedure codes, whether it's psychotherapy, pharmacological interventions, neurotherapeutics, whatever it is, to treat those codes. However, a couple things. Number one, the line has moved, and in two directions. One, I think we're diagnosing lower, normal, sometimes healthy levels of anxiety as a disease, as a diagnosis. And in concert with that shift, people are much more anxious today.
How can anxiety be just as helpful?
I think there are 9 tools in my book, firstly, so, it's hard to talk about all of them, but a couple of broad comments. Number one, just because you're having a misfire of the fear system doesn't mean something's wrong. And we have this tendency to interpret it as something's wrong with me. I'm not able to tolerate these high levels of anxiety. This is an impossible situation. I need to get rid of these feelings. Otherwise, I'm not going to be healthy. And by and large, that's not true. People can actually function very well with high levels of anxiety. One of the best ways of treating anxiety is what we call exposure therapy, which is a form of cognitive behavior therapy where people face their fears head on. And I have treated literally thousands of patients with this approach, where in the session, when we are confronting their fears together, they're having extremely high levels. They're panicking, they're sweating, they're having deep breathing, and I don't mean intentional. They're involuntarily sucking in oxygen to keep their heart going. It's very unpleasant. It's even unpleasant for me, but that builds resilience. It builds I believe their neural and emotional strength. And as a result of those sessions, they actually become less sensitive to anxiety. And that's one way that anxiety can help us if we take an opportunity, this is one of the tools again, to face it, that can breed greater resilience and strength to face life challenges.
So in trying to I guess, eliminate these symptoms with our current approach, we're increasing the anxiety.
Correct. Because the minute I feel anxious, now I'm upset about the fact I feel anxious because I've been told it's a disease and it's a disorder just to feel a little anxious. And the minute I feel that nervousness, I'm going to get a boost of adrenaline, which is just going to make the anxiety worse. And that's a cascade. That's a cycle. It's a vicious cycle that many people in our society get caught in. And if you reframe anxiety as an opportunity to, bolster your resilience, to connect with others, and for spiritual growth, frankly, which I speak about in my book, then it opens up new doors to use our anxiety for good as opposed to trying to get rid of it all the time, which is typically what we try to do.
What do you say to the people that think that a person who is anxious, dealing with anxiety, is basically focused in the future, not knowing what the future holds, and a person who is depressed is living in the past? What is that?
The past, yeah.
Is that
there's some
myth?
Truth to it.
Some truth? Okay.
No, there's some truth to it. I'll tell you where the truth is. This is the difference between worry and rumination. Worry is when you're worried about the future, right? You're apprehensive. What if? Rumination is when you're upset about the past. Oh no, that conversation I had with someone, I shouldn't have said this. I shouldn't have done this. I can't believe, And the latter is more associated with depression and the former more with anxiety. But firstly, they're highly comorbid. So people who think a lot about the future also tend to think about the past. And more importantly, when people are worried about the future, often what they're doing, they're actually not fully experiencing their anxiety. Some of the clinical science has shown that worry is a way of actually, ironically, avoiding anxiety because you're not really letting it seep in what could happen. People are what if, and it's very shallow, as opposed to actually really contemplating our lack of knowledge and our lack of control, and embracing that as human beings. And that's really where the opportunity of anxiety lies.
Thriving with Anxiety, 9 tools to make your anxiety work for you. What was it that you saw in your daily practice with your thousands of patients that prompted you to say, you know what, I need to write a book. This is so significant and important. I need to write a book.
There were 2 things that happened. The one was I see the mental health of our country and of the Western world falling off a cliff right now. And I think the chief reason is because we have this mistaken impression that we have to feel good all the time. If we start to have even minimal, small levels of symptoms, it's a reason for a diagnostic code. It's a reason for a professional intervention, as opposed to learning to utilize this in the course of normal human life, that we're going to have some level of distress. And I think that that's the biggest factor. But and in concert with that, the second thing I saw was during the pandemic, patients who were in my offices before the pandemic struck, before March 2020, were actually doing just as well, if not better, afterwards. It was a patient that came in afterwards and had never had anxiety. Those were the ones who really struggled.
Give us a website where our listeners can learn much more about you and your book and get a copy as well.
Sure thing. So my author's website, my personal website is dhrosmarin, ROSMARIN.com. And for information about Center for Anxiety, it is centerforanxiety.org.
David, I appreciate your time this morning.
Happy to chat anytime. Thanks for having me on your show.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. David Rosmarin. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.